back now with today's checklist just in time for the new year. So in January, a lot of people hit the reset button on their health and wellness routines. But where do you start? So here to set us up for success heading into 2025 is nurse practitioner Barbara Dehn, known as Nurse Barb. Good morning to you.
Morning. It's great to be here.
I'm so happy to have you here. So why don't we start with, maybe you can clear something up and talk about exactly what is a nurse practitioner and your approach to care? How does it differ?
I mean, so many people are confused, right? Because are you practicing to be a nurse? Right? Not really. So nurse practitioners, we have advanced degrees, masters, sometimes doctorates, more training. There's 385,000 of us. Wow. And every year we see 1 billion with the B patients, right? So nurse practitioners examine, prescribe, diagnose, and treat in lots of places, hospitals, clinics, offices. And in rural areas, often we're the only provider for hundreds of miles.
Okay, thank goodness.
And how can folks find,
People can find us at npfinder.org.
Okay.
And if you're having trouble making an appointment for an annual physical, consider seeing a nurse practitioner because we love seeing patients and we love working with our physician colleagues.
Well, let's get through a lot of the appointments that people try to squeeze in at the end of the year. All of a sudden, they're like, I haven't done this, this, and this. Take us through the checklist of what we should be doing.
I'm so glad you asked. And so often, it's the women in the family who make the appointments for the annual physical. But also, we sometimes forget the dentist and the eye doctor. And so oftentimes, when you're going to see someone, it can take months to be seen, but make the appointments now. If you have a family history of early heart attack before age 50, you want to ask for a lipoprotein little a. This is a type of cholesterol that causes more atherosclerosis, and so do ask for that. Virtually everyone should ask for a vitamin D level, and for women, mammograms. You know, the guidelines change every minute. So what do? I recommend the American Cancer Society starting at age 45. But if you have a family history or you're worried, ask for your mammogram at age 40. For the men in the family, prostate surface antigen. It's just a blood test. Nobody's examining someone. And it starts at age 45. For African-American men or men with a history, start at age 40.
Okay. Let's talk about gut health, because it seems like there's a lot of talk about that in 2024 especially. Can you explain, first of all, why it's so important and maybe some tips for a digestive system reset?
Yeah, I know all of you probably eat a lot of fruits and vegetables and a lot of grains because you're all really healthy.
Cookies.
But not everybody is. And people are surprised to learn there is a universe of trillions of bacteria that are in our gut. So it's not just about getting things to go through, right? It's about your gut health helps your immune system, it helps your memory, and it also helps your mood. So there's 3 things to remember. 1, whole grains, beans, lots of fiber, but also probiotics and prebiotics. So probiotics are things like fermented foods. So, Craig, I know you like to go to the ball game, right?
I do.
You want a hot dog?
Yeah.
Sauerkraut.
Sauerkraut.
Okay.
Do you like pickles?
I like kimchi and pickles too.
I do like pickles.
Kimchi, pickles, yogurt. They all have those healthy bacteria because we have healthy bacteria in our gut biome and it helps everything work better. But you also have to feed them. You have to give them prebiotics, lots of fiber, blueberries, artichokes. Also, think about soybeans. Those all help.
Okay, what about, especially this time of year, helping us get mentally reset and ready to go into the new year?
Right? You guys know this, right? There's so much pressure to make everything perfect. You're trying to make everything perfect for the audience and your families, and everyone at home is too, right? So the mental reset, there's a couple things to do. First of all, we all know about diet and exercise, especially exercising outside. Social interactions, one-to-one group interactions. We've all heard about the word games, right?
Yeah.
I bet you didn't know that a multivitamin every day has been shown in 3 separate studies to improve memory and to reduce cognitive aging, help people make decisions, help people make links. So yeah, it takes time to do a word game every day, but it doesn't take long to do a multivitamin.
You're right.
Or go to a cookie swap.
There you go. There you go.
A cookie swap.
Social interaction.
Because if you have sprinkles on top, it's even better.
There you go.
Barb, thank you.
Good advice. Thank you, Barb.
Thanks, Nurse.